You have a lot of neat stuff in your office. We've talked about it. You got lasers, you got, just 21st century stuff, which is pretty neat and always cool to hear about. So 3D x-rays, what exactly are they, and why would I need a 3D x-ray versus over the x-rays that have worked for the past 50 years for me?
Well,
I put you on the spot, didn't I? But I know he's going to have an answer to which does.
We used to use a quill pen to write letters.
Yes, we did. But the letters are still wonderful. The Constitution is wonderful.
For sure. It works great. But trying to copy that again, the handwritten, and I could just email it to you, copy and paste it.
Right. Yeah.
So three-dimensional imaging is the doctor term. X-rays, radiographs. All right. So you go in, you get your little tiny X-rays when you have your teeth cleaned. Why should a patient ask or request to have 3D x-rays taken? Well, I'll tell you why. There are a few reasons. The two-dimensional means you only see up and across, up and down and across, right? A lot of information there. And when I first started as a dentist, we did not have digital. It was like a camera, then we'd take the film and I'd go in this room, or the gals go in the room, they dip in different solutions and rinse them off, and you hang them up, you let them dry. And if somebody opened the door on you when you were...
Then it meant you definitely had cavities because it would just go black.
For sure. We didn't know let's go fill that too.
Yeah.
So with the digital, we take a picture like anything. And now, if you're watching this, you know what digital is. You've been on the planet long enough. So it seems like it makes sense. Anyway, with the digital x-ray, we can, 3D digital, it's an x-ray that goes around your head, all right? And my particular unit is called the Prexion. And in about 14 seconds, it scans what's called a volume about right here, all the way around, okay? I can pinpoint and put like a scope on the screen right to the area that I'm looking, and I can virtually on a computer see, like you see these sci-fi movies where you see the skeleton.
Yeah,
and
right.
They're turning the body around and the head.
You're doing that with the tooth that you want to look at.
It's actually your upper and lower jaws, and I can enlarge and shrink down. We can virtually plan things. So the importance of it, forget about all the stuff mechanically we can do. I don't know if you've seen the commercial. It's called the TAVR procedure. It's a heart valve replacement. And they're reporting that they can do a valve replacement within an appointment, surely, and then you're out of the hospital in one day.
A valve replacement, heart.
Valve replacement. Okay, it's called TAVR. What does that mean to the dentist? I'm not doing valve replacements, but what I am doing a lot is examination before cardiothoracic surgery. So if you had a heart valve replacement scheduled and you come to me and you bring me your form that tells me exactly what the doctor is going to do, and it says schedule and the schedule's blank, I have to fill out the second half of that page that says, Randy came in, I did a dental examination on the date, I reviewed the x-rays, but if I have two-dimensional x-rays, and you have dental infection, and that's what the physician, the cardiologist, is asking me. Does Randy have dental infection? Because if Randy has dental infection, we can't go in.
We can't do this.
And replace his heart valve.
Pretty important stuff.
Right, because you could die, all right? So if you take a two-dimensional, that means when you're sitting in the chair and they put this wafer in your mouth and it pinches and it hurts and this wire hangs out and you got this cone up against your head. We take the x-ray, particularly in your case, you're a decent-sized man. If your bone is thicker on the outside, your cheek side, and you have an infection internal, that bone density is so thick that the x-ray goes through, but it only picks up the most dense area and shows it on the camera or on the film and on the screen, so it's inaccurate.
Okay.
It's not clear. It's ambiguous. It means nothing.
You're literally not getting a good picture of what's going on there in the mouth.
No, you're not. So I'm thinking I probably should call the cardiology people in my neighborhood and say, hey, just so you know, like I explained to Randy, that thick bone on the outside and you take an x-ray, it's, not going to show a clear infection, and I can show you some examples. And now here's the 3-dimensional x-ray that we took, and it's clear as day. I can measure the entire volume and how wide it is, and why this tooth should have a root canal, or why should have it be pulled, and yada yada. That's why when you go to the doctor or the dentist, you should ask for, if they have 3D x-rays, and particularly if you are going to have some type of joint replacement, heart, it just makes common sense. You know, it's a quick, easy, most of the time covered under insurance, dental. Something to think about.
Well, I tell you, fortunately for me, my heart's doing okay. But let me ask you a question. If I had to come in, people maybe think about this, because X-rays or, X-rays, something's aiming my head. Safety factor of having this.
Yeah, that's a great question. So we mentioned earlier, back 30 years ago, we were dipping films.
Yep.
So it's depending on what instrumentation you're using in your practice. It's going to be 10 to 20%, or in other words, 80 to 90% reduction of energy being utilized.
Really?
So it's, in other words, I can take 10 x-rays today compared to taking only one back in the day.
That really is marvelous.
It's a significant thing.
Wow.
Now, and then, everybody uses the comparison. Listen, if you go out and you lay down in the sun by the pool, you are irradiating yourself more. But then someone say, well, I'm out in the sun a lot. Why would I get more radiation? I totally get it.
Yeah.
Totally get it. Well, all I'm saying is, if you're going in for heart surgery, or you're concerned about your overall dental health, which affects your total body health, you might want to consider, you want to consider asking if there's 3D imaging available within your dental practice, for whatever the reason is.
Even just to ask your dentist if there's 3D, and he looks at you with blank deer-like eyes, and maybe he'll say, "What's that?" Who knows? Then you can tell him.
So, I have docs in my neighborhood that don't have them, and when I see them at the coffee shop, I say, "Hey, look, I'm not trying to steal your patient, but I'm pretty passionate. I feel strongly about this. In this case, if you have patients that are coming for heart surgery, I know you. Like, if you're a dentist, say, Randy, look, I know you don't have the machine. It costs some money to get it, but I think you should have it. You're not getting it. You have a patient or family member, anybody that you're concerned about that's going to have a heart, knee, shoulder joint replacement, or just general want to know.
Let's make sure everything will turn out okay.
Just have them come down there. I'm not going to charge them.
Yeah,
I'm not going to charge them.
That's great.
Just come on in. If it gets to be an abusive situation, like Randy, okay, now it's golf, it's dinner, you know.
Yeah, nice is nice, but come on, man.
Yeah. So I have a relationship with my chiropractor. He's 2 doors down, and we do the same thing. If it's dentally related, I take the x-ray. If someone's complaining about neck pain, but it's a TMJ or migraine, I send them down to Ramsey Chiropractic, which is right next to us. So, buddy, take care of these people when they come in.
Oh, great. Hey, thanks for sharing. As always, a lot of fun and some neat, finding out some neat stuff here.